The celebration of the Minority National Days marks a milestone in the progressive effort in establishing a conversation around diversity, equity, and inclusion. April 24th, across the United States, communities are marking Minority National Day with vibrant celebrations, cultural showcase, and renewed discussions around minority, especially those that have died from disease due to lack of adequate health care.
Our National Minority Health Month observance on today. And today is just a really small, intimate day to observe those who are still battling with chronic illnesses and diseases in West Virginia and all over the world. And today we'll also honor those that have passed away from chronic illnesses and diseases like diabetes, cancer, and so forth. So today is just to honor those and to continue to bring awareness to those that do have chronic illnesses and diseases, and hopefully with our partners we can collectively come together to help combat those chronic illnesses and diseases. My name is LaDonna Walker-Dean, and I'm the director over the West Virginia Minority Health Initiative under the Minority Health Institute under the auspices of the Department of Public Health here at Marshall University. Thank all of our partners and organizations that have come out today to observe this special day.
Minority National Day, originally established to honor cultural heritage and contributions of minority groups. The day had grown into national observance that celebrates the richness of American multicultural identity.
The observance serves as a reminder of the systemic challenges faced by racial and ethnic minorities in accessing quality health care, as well as the need for effective strategies to address these barriers. Historically, minority groups in the United States, including Black, Hispanic, Native American, and Asian American populations, have faced higher rates of chronic diseases such as diabetes, hypertension, and cancer, as well as poor health outcomes. These disparities are driven by a range of factors, including socioeconomic status, access to health care, social determinants of health, education, and environmental conditions. Furthermore, cultural barriers and discrimination often prevent minorities from receiving the care that they do need. This year's National Minority Health Month theme emphasizes the importance of cultural competent care and the role of community involvement in addressing these disparities. Health equity is about ensuring that everyone, regardless of race, ethnicity, or socioeconomic status, has the opportunity to achieve their full health potential. By working together to improve access to health care, promote prevention, and support community-based health initiatives, we can all make progress toward closing the health gap for all and shutting down the silos in our state of West Virginia and throughout the world.
Minority National Day is not just a celebration, it is a powerful reminder of the work still ahead. And speaking during the celebration organized by Minority Health Initiative at Marshall University, Dr. Alan Litton, Director for Center of Economic and Community Development in Black Operation, an isolated community, a visiting scholar, told a personal story about his father, who, despite being a black man, faced with a lot of barriers, still struggled to study and became a chemist.
African Americans exhibit Alzheimer's or dementia-related diseases at twice the rate of the general American public. And unfortunately, my father was one of those people. He passed away about 11 years ago from complications of Alzheimer's. And he was a brilliant mind. He was one of the first black PhDs in chemistry. He worked with Dr. Percy Julian, who, if you don't know, he was the first black chemist to own his own pharmaceutical company that became part of GlaxoSmithKline. And my father became one of the senior scientists at Procter & Gamble, so he was what was called a big deal fellow. There was only 8 around the world at that time. And so he really contributed a lot. If you like Duncan Hines soft batch cookies, that was one of his inventions. And so we all got fat because of that. But a year after my father had passed away, it hit me that because of the genetic nature of Alzheimer's, I was probably destined to experience some form of dementia in my life as well. And I had to struggle with that, and that's where this poem comes from. So let me just go ahead and read it. The wonderment of the mind, intricacies of God-given ability to create from simplicity, to twist the complex into peaceful understanding. It is a divine gift, an individual talent, snowflakes of the human race, defined uniquely to each, given in the collective and revolutionary in the singular. Love, the undefined consequence of emotion and unqualified comprehension, the ability to rationalize the rational, to accept without logic the logical, and to find joy in the discomfort of detachment and the anticipation of a unification of experience driven by a playground of hope and ambition defined in the mind's forecourt. My mind in time will decay to oblivion. It will be encased by an unreal reality, a non-existent existence, drifting in and out of a world painted from the brilliance of a constructive life. It is mostly inevitable and partially a chance. So I acquire every experience, truly live in this moment, anticipating the unknown time when the scales will tip to oblivion like a flight into space and become the dark, deep norm. I live in this moment, finding passion in this life and finding joy in this love. Frustration comes from the knowledge of limited days, from knowledge of the probable inevitable while hoping for the unlikely possible. I will love hard, will burn both ends of the torch, racing a demon without the power to destroy and without the knowledge to delay. I will have and live my life. I will experience that great love, and I will give you all that I have to give, so one of us will remember when oblivion is here. Thank you.
One of the biggest challenges faced by the minority is accessibility to healthcare. The reason many minorities suffer from chronic illness, including cardiovascular diseases. Research and statistics have shown that low income lead to low social status, poor housing, low education, which make it difficult to break the barrier of poverty.
Chronic diseases, substance abuse, and mortality rates for preventable conditions. So when we talk about chronic diseases and those health outcomes, what does it look like? West Virginia has some of the highest rates of chronic conditions such as heart disease, diabetes, and cancer in the nation. These conditions disproportionately affect minority and low-income populations in the state, so we're not just looking at race and ethnicity, we're talking about the whole board. In particular, Huntington, located in the western part of the state, is known for its high rates of cardiovascular disease, obesity, and diabetes. According to the West Virginia Department of Health and Human Resources, nearly 40% of adults in the state report having at least one chronic health condition, and many of these conditions go undiagnosed or untreated due to limited access to healthcare facilities and services. Access to healthcare is a major issue in West Virginia, where rural areas are often underserved. Huntington still faces challenges in providing adequate healthcare resources to its residents. Many communities in the state are designated as healthcare deserts, with few providers in rural area and long distances between patients and hospitals or specialized care. This lack of access to timely and appropriate care contributes to the poor health outcomes seen in this region. Low-income residents, particularly those without health insurance, are at even greater risk of facing barriers to health care, resulting in delayed diagnosis and treatment.
The celebration was also crowned with bingo and other activities where participants won some prizes. One of the ways to break the barrier of social injustice, poor health, low income, is to invest in education. And students from Marshall University Department of Public Health came out in their number to participate in this year's Minority National Day. Ernest Kumba for Gaza Media.